people commonly have problems understanding is the difference between when is the asthma a problem or when do I have to worry about pneumonia. If you look at it, the most common presenting symptom of asthma is cough. Second most common is wheezing, and the third most common is recurrent diagnosis of pneumonia, when in fact it wasn't pneumonia to begin with. Pneumonia means that your air sacs are filled with pus. In classic bacterial pneumonia, those infections are usually localized to one area, and it's not subtle and nobody misses it. So everything else is fine, but that one area is completely socked in with pus. Often those patients have no other symptoms, and then 12 hours later they have a high fever and are very sick. And a lot of times they don't have a whole lot of respiratory problems because the rest of those lungs are fine. They're just more sick than they have any breathing issues. Whereas in viral pneumonias or mycoplasma pneumonias, those often start up in the upper respiratory tract, and then those infections spread down the air tubes down into the lower part of the chest. Now, when those infections extend all the way out into the air sacs, that's pneumonia. But it's walking pneumonia, bronchopneumonia, viral pneumonia, mycoplasma, or atypical pneumonias. Those are really pretty interchangeable terms, and they all mean the same thing. But just like any other viral infection, if it is a virus that's causing it, there really isn't any treatment for that. You just wait it out and try to make the patients as comfortable as possible. Whereas bacterial pneumonias take a very long time to get better. Chest x-rays are not going to be able, you're not going to miss a classic bacterial pneumonia on a chest x-ray. But if it's a viral pneumonia spreading down, kind of going all over the place, that and asthma would look the exact same on chest x-ray. So you're never going to be able to know for sure, is it all just asthma, or is it asthma and a viral or mycoplasma pneumonia. What's more is, since the cold is a very potent trigger for asthma, having a viral infection up here is a potent trigger for setting the asthma off down here. There's no way that you'd get one of those infections that goes down in throughout here and have it not trigger the asthma too. So then you'd have both problems to deal with. And so you still treat the asthma to make sure that we get that part out of it. In a sense, you can't really do anything about the viral pneumonias. There isn't anything, we just wait and keep the patients doing, keep them hydrated and keep them comfortable with Motrin or Tylenol for a fever if it's bothering them.